Are we live now, Dustin?
Yes.
Okay. Good evening, folks. This is the convening of the Central District Board of Health meeting for Tuesday, December 8th, 2020. It is 5:15 p.m. I am Betty Ann Nettleton, the presiding chair. I represent Elmore County along with Representative Megan Blanksma. And I will go ahead and call the meeting to order. We will have roll call by counties, starting with Elmore County.
Representative Blanksma, present.
Boise County.
Commissioner Stern, present.
Ada County. Dr. Young.
Jane Young here.
Dr. Epperly.
Ted Epperly here.
Lachiondo.
Commissioner Lachiondo here. I'm sorry, I just got a text from my neighbor that there are protesters at my house, so I'm going to step off for just a moment to call the police because my kids are there. Thank you.
Okay.
I've also got protesters outside my house as well.
Valley County.
Commissioner Hashbrook, I'm present.
Okay, thank you, folks. Moving on, under our action items, Director Duke, do we have any changes to the agenda?
Madam Chair, there are no changes to the agenda this evening.
Okay, thank you. Okay, next on our agenda is an update from our healthcare providers on the impact of COVID-19, and I'm going to turn the introductions over to Director Duke.
Thank you very much, Madam Chair. We heard from two of our three health systems here in Boise last Friday, and I wanted the board and certainly the public as well to hear how this pandemic is impacting our frontline workers. That would be primary care, where you go if you have a cold or potentially a broken bone or need other health care rather than going to the hospital. So I have invited Dr. David Peterman, who is the CEO of Primary Health Medical Group. They have 20 clinics here in Ada and Canyon counties. I've also invited Sean Rain, and Sean Rain is the chief paramedic for Ada County Paramedics. So again, a different perspective than what you've heard from the hospitals, but it just, again, it will emphasize really how broad the impact is on all aspects of healthcare delivery in our community. So I'd like to start with Dr. Peterman.
Well, thank you, Russ. And before I came on, I had a chance to talk with the representatives and commissioners. Number one, I want to thank all of them. This has really become a thankless job. You can't, in a sense, win anyway. So I appreciate all of you serving. And it's too bad the public can't, in a sense, witness what I witnessed, which is how freely you all talk, joke, acknowledge each other, respect each other. It's certainly an example I wish the rest of the community would follow and see. So I want to just thank you for what you've done. I presented to you, I believe, a couple of months ago and had graphs and various things. And frankly, this time I thought it would be better to not show graphs and just give you a sense of where we're at and what my thoughts are. I have no political agenda. In a sense, as a pediatrician, I don't care whether you're a Democrat, Republican, Independent, Libertarian. We're going to take care of you.
Can I interrupt you for just a moment? My 12-year-old son is home by himself right now, and there are protesters banging outside the door. Okay, I'm going to go home and make sure he's okay, so I will reconnect with you when I get there.
Okay, Diana. Go ahead, and bless you.
Well, I mean, again, whether I'm a pediatrician or not, I'm a father, and that's just unbelievable. And if you'd like me to continue, I certainly can. But Have the police been contacted? So she's okay. Her child's okay.
Dr. Peterman, I'm not sure. I know she said she was calling the police, but I'm going to step away for a minute as well and make sure our staff are aware, because as I noted earlier, a lot of the BPD officers are here helping us right now. So
That's what great. Okay. Yeah, I'll continue. Is that the rest? Should I continue?
Yes, Dr. Peterman, please do.
Okay. All right. Thank you, Chair. So again, my perspective is from a clinician in our clinics. Just to review, we have 20 clinics. They're in Ada and Canyon County. We do almost exclusively primary care, family practice, pediatrics, acute care, and our urgent care clinics. We see over 500,000 visits a year, and we're the primary care doctors for 70,000 patients, and we have 100 providers. We are the doctors for your friends, your children, your grandchildren, grandparents. It's what we do every day. It's what Dr. Eppley does, and frankly, quite a few of the residents from his program are part of our group. Instead of statistics, I wanted to give you two instances of patients that were encountered, one by myself just 2 weeks ago. A mother brought in a child, a 2-year-old, and she had her 4-year-old with her. The mother was in tears, and the purpose of the visit was a regular exam, but to update on how the child's behavior was doing. This is a 2-year-old who was not using words, and this was a 2-year-old whose behavior was very abnormal. Now, any of you who have children, of course, would know that a 2-year-old that's not using words is not normal. And I think most would recognize that this child's behavior was also different. What was frustrating here and what relates to COVID is normally this is a child who would be getting speech therapy. This is a child who would be getting behavior therapy. And in some instances, what's referred to as occupational therapy would also be this child. This child also would qualify for the infant toddler program, which is a wonderful program that's actually federally funded, but throughout Idaho in elementary schools for children who need special help. This child could not get any of those services because of coronavirus. That either teachers were out or there was disruption in that particular elementary school. Tried speech therapy through Zoom. It's hard enough with an adult with Zoom, but a 2-year-old. And my point I'm saying here is when someone makes the statement, you can't tell me whether or not I wear a mask. Whether or not I wear a mask is my freedom, and I can choose whether I want to get sick or not. My response as a pediatrician, no, when there's more disease in the community, when you don't wear a mask, it leads to the 2-year-old who I can't get therapy for. And we know very clearly children with this kind of deficit in language, the early intervention is incredible. It makes a difference. But every month, every day, every week, you delay that speech therapy or behavioral therapy for that child, you will have greater problems downstream. And so this is a kind of impact that is every day happening in primary care. The second case I want to bring to your attention is an 18-year-old, quote, who's a normal 18-year-old. Well, he was normal before COVID. He now has a scar on the left side of his chest that's maybe 12 to 18 inches long, and he now has wires that are connected to his heart and a pacemaker. He got COVID, and he developed myocarditis, and he now needs a pacemaker. Obviously, that is life-changing. Again, what am I bringing to your attention, to the public's attention? That every day, coronavirus is impacting primary care physicians and their ability to take care of their patients. And so again, when someone says, I don't want to wear a mask, or it doesn't matter because, I can deal with myself. What I'm saying is, no, this is spreading in the community and it's impacting the patients that I see and the parents that I'm working with. In terms of how is this affecting our clinics, we are overwhelmed. Normally, primary health in our 20 clinics get about 1,800 phone calls a day. A month ago, it was over 3,000. Now it is over 4,000. So if your child has an earache, or if you or a parent or a grandparent or a spouse is having trouble with their medication and they call our offices, I can't guarantee you we can answer the phone call. We have gotten to a point now where care is being interrupted because of coronavirus. We are overwhelmed. Excuse me?
Madam Chair, Dr. Peterman, I'm sorry to interrupt, but I got a call from the mayor, and it sounds like the police, and she is requesting that we stop the meeting at this time because of the intense level of protesters in the parking lot and a concern for police safety and staff safety, as well as the protesters that are at some of our board members' homes right now. So I'm not sure, Madam Chair, what we need to do other than I think we do need to cancel the meeting.
Would you like me to call for a motion for adjournment at this time, Russ? Let's do that. I'm asking
Yes,
for a motion.
yes, please. And I apologize, Dr. Peterman and Sean, for your preparation for this evening, but it's a matter of safety for everyone at this time.
No, you've got to take care of people. It's not worth, and everyone has to be safe.
Thank you.
Thank you, Dr. Peterman and Sean. I will ask for a motion to adjourn the meeting at this time.
Madam Chair, this is El.
Madam Chair,
Go ahead.
I make a motion we adjourn the meeting to a later date to be determined by the chairman.
Madam Chair, this is Representative Blanksma.
Yes, Megan.
Just an update. I just went out and talked with BPD. There's been one person detained, but they indicated that they have the situation under control.
Sadly, it's not under control. It is not under control at my house, and it's not under control at Diana's house.
I am just telling you what I got from the hallway from the officer.
Russ, are you there?
I am, Madam Chair.
Okay, and you say the mayor requested we end our meeting, correct?
The mayor and the chief of police requested that this meeting be ended.
Okay, all right. We have a motion. Is there a second?
This is a second, Jane Young.
Okay, thank you, Jane. Okay, barring any further discussion, I will call for vote by county for motion approval, starting with Elmore. Elmore, Megan? I can't hear Megan.
Aye.
Boise County? Ryan?
Commissioner Sturm, aye.
Okay, thank you. Ada County, Dr. Young?
Jane Young, aye.
Okay, thank you. Dr. Epperly?
Ted Epperly, aye.
And Commissioner Lasciando is not on the call. Valley County?
Mr. Hasbrook, aye.
Okay, thank you. Motion does pass. The meeting does stand adjourned, and I will be in contact with Director Duke, and the next meeting will be to be determined, will be posted on our website. So thank you, everyone, and stay safe.
Welcome to this module, in which you will be provided with an overview of the human body and the physiology of its various systems. Once completed with this module, you should be able to identify